Beth, it still says we're in practice session. Is that right? Good afternoon, everyone, and welcome to Member Cafe. So glad you're here to spend time with us for about an hour. We're going to give it just a few minutes to get everyone logged in before we get started. So just hold tight a minute. All right, so good afternoon. Our numbers have leveled off for those logging in. So I'm going to start while Beth brings up our slides for us. My name is Ann Gluff, and I am part of the member engagement team here at Partners Health Management. And again, so happy to see you here today. Joining me today, I mentioned Beth. Beth Brooks is a coworker, and she is our Zoom guru for today. She will keep everything running nice and smoothly. And then also today, we have a few other members of the member engagement team. Sasha Bonner is here today, and she's going to be sharing some information about partners a little bit later in the session. Lindsay Green is here. They're both member engagement specialists, and you may have seen them out in the community. Lindsay will be dropping some great information into the chat for you so that you can grab that information really easily just to cut and paste. And also here today is our Senior Director of Member Services, Ms. Allison Crotty. And we have some subject matter experts as well, and they'll introduce themselves as they are answering questions for you. So before we go into our session about tailored care management, I want to share just a little bit of housekeeping. So today's session is offered in closed captioning. If you don't need this feature, all you need to do is simply go to the bottom of the screen and hover over the live transcript and click on it to hide subtitles. I also want to let you know that the meeting is being recorded. So if you do come on mic later on during questions, just be careful to not answer, and excuse me, be careful not to share too much personal information. We are available to support you and talk to you about individual issues, we being member engagement, and we will give information later on in the session about how you can connect with us. The slide, along with the recording, the slides will be sent to you after the session. So all those that are attending will get a follow-up email with the slides included. And then the recording will be available on our website under member education. Got to give us about 10 days or so, maybe a little bit more. We're a bit busy and we're trying to get to everything. So now let's take a look at the Zoom features. I just want to make sure that you are aware that our chat is turned off for our attendees. We can chat out to you where we'll be providing information, but I really want to encourage you to enter any questions that you have into the Q&A. Both of these features are noted at the bottom of your screen. You're simply going to click on the Q&A and you're going to enter your question. And we will have some times where we stop and pause to answer your questions. We'll also give you a cue that you can raise your hand and be unmuted so that you can talk with us and share what your question is. So that is absolutely your choice. So Beth, if you want to go on to the next slide, that would be great. So before we get into tailored care management, I wanted to share something little that's been going on here at Partners, not quite so little, but tailored plans are live. July 1, we are excited to say that they have gone live on July the 1st, and the tailored plans have successfully launched. So, when something new starts, we all know nothing is perfect. So, something new begins, and there are questions and concerns. And so, I am super proud to let you know that the Partners team, every one of us here at Partners, has been hard at work helping our members and providers with all the questions and concerns about the new details of the tailored plan. One thing I want to tell you is what you can see on the screen here is Partners website. And Beth is actually going to take us right over to the website because I want to show you a few things where you can find how you can get questions answered. So here we are. This is our live website. And right underneath where it says tailored plans are live, you see 3 blocks there. And right up above those 3 blocks, it says get the tailored plan information that you need. So that first block takes you to the tailored plan website. The one all the way to the right shares contact information, a phone number, and also some email addresses that you can utilize to send questions to us. And then right in the center, which is where I really want to go, is an FAQ, frequently asked questions. So Beth is going to click on that and take us right to the frequently asked questions page. Excuse me. So right here, if you look right underneath the photo, you see it says member frequently asked questions, and there are some topics there. General questions, tailored care management questions, a great place to go if you have more questions after our session today that didn't get answered, pharmacy questions, primary care provider questions, non-emergency medical transportation questions, and then Medicaid ID card questions. So I'd like to take a look at non-emergency medical transportation. So Beth is just going to simply click on that. It's going to take you right to non-emergency medical transportation, which we call here NEMT. We have all of these acronyms, NEMT. So underneath there, you see 4 different questions there. These are questions that come up quite frequently. So Beth, if you would go ahead and click on how do I schedule transportation? That first question. So it pops open the answer to that question. And so the answer to the question about how do I schedule my transportation is you make a phone call to Partners, or you can call our vendor directly, which is Motive Care. Motive Care has a contract for the entire state of North Carolina to provide Medicaid, non-emergency medical transportation for your appointments with a Medicaid provider, a doctor, could be a behavioral health appointment to a counselor or a therapist. It also could be that you need to go to the pharmacy to pick up that medication that's been prescribed for you. So that first number you see there is a direct line to transportation. It's 833-577-2309. And I know Lindsay's dropping these numbers in the chat for you so you can easily copy and paste them. And then the other number is our member and recipient services line at 1-888-235-4673. And if you're a person that wants to remember just one phone number to get to what you need, that's your number, 1-888-235-4673. This does take you to our call center, and you're going to get a menu. And from that menu, in this case, you would be able to select transportation. But that phone number is going to get you to a lot of different things. If you want to go right to Motive Care to schedule your transportation, you're going to use that other number, 833-577-2309. And since we're talking about transportation, I want to let you know that when you do call that number for the first time, you're going to go through a registration process. You can do it with the automated system with the phone call, or you can talk to a live agent. But you do need to have your Medicaid ID number, and you will also need to have your appointment already scheduled with your doctor, your therapist, whoever the appointment is with. You'll need to know the address of where it is so that you can get that entered into the system so they know where they're taking you, and also, of course, where they're picking you up and dropping you off. but the automated system will walk you through that process, or you can select to talk with a live agent if that's your preference, and they'll walk you right through. So there are more questions there in the Q&A about transportation, but I also wanted to point out the other two options you can see here. One is member Medicaid ID card questions. So Beth, if you'll just click on that right there, how do I get a new member ID card? So maybe you got a member ID card and it didn't have something right on it, or you just didn't get one, or maybe you lost it. This is one place that you can go to get your Medicaid ID card. And you can see, Beth, if you just point to that, where a Medicaid ID card replacement form, when you click on that, we're not going to bring that up right now, but it is a super simple form that you're going to fill out. Your name, your address, a few more things, really simple. And it's going to send into our member services team, and that Medicaid ID card will get mailed out to you. So since we are talking about simple, easy forms, I want to show you something else on our website. Going to our main page on our website, you can see it says right there in the center, Partners Tailored Plan. There's a lot of information here, but what I want to point you to is that green banner at the top there. And what it shows you is a couple of different things. One is it says, I believe it's the third line down, that says, if you need your Medicaid ID card, it's over to the right, you just click there and it's going to take you to that form. Same form, super simple form. You're going to fill it out, click a button, and you're done. It goes to the right team. The other one that you see there on that very same line is need to change your PCP. So PCP stands for primary care provider. So if you need to make a change to your primary care provider, your doctor, your main healthcare, that's noted on your ID card, you're going to click there. Same thing. You're going to get to a very simple form. You're going to complete it. And our team here at Partners is going to help make that happen for you. So that green banner is just super important, really easy to access information. So I really encourage you to, when you have a moment, to peruse around the Partners website. There's a tailored plan website. There's a Medicaid Direct website with all of the information that you need. Okay, one more thing before we move on. I wonder if any of you have heard of Member Connect, our member portal. So Beth, if you would take your cursor, there you go. Member Connect. Member Connect is our member portal. That's where you as a member, or perhaps you're a parent or a guardian of a person who's a member of Partners, you can create a login. And this is where you can go in and look at your information on Member Connect. You can look at your documents. You can secure message, partner staff, perhaps your care manager. If you're not sure who to talk to, you can just send a message in and someone will get back to you from the member engagement team to make sure that you get what you need. So Member Connect. All right, so let's move on to the next slide, Beth, and we're going to take a look at your member ID card. If you're a member, you should have received this in the mail. And I want to point out to you some phone numbers that are right on your member ID card. First, you're going to see your name, of course, or the member's name, their Medicaid number. This is what you need to have with you when you schedule that transportation. You're going to see your primary care provider information on the front of the card, which you see to the left on your screen. And there's some information for your pharmacy there, where you see it says the BIN number, and there is a pharmacy phone number towards the bottom of that little section. That phone number right there, which I'm going to show you on another screen as well, is for you to call if you have questions about a medication or questions about pharmacy. And it's also for your pharmacist to call. So if you are at the pharmacy and your pharmacist is asking you a question, that's a number that they can call to get answers. And then if you look at the back of the card, You will see at the very top the number for member and recipient services here at Partners. And that's that number I said. If you're a person that wants to know just one number to remember to get the answers to your questions, this is your number: 1-888-235-4673. And this is that number that goes into our Access call center, where we have licensed clinicians and qualified professionals to support you. The next thing that's on the back of your card is Partners Member Connect. We just pointed that out to you. So I already shared a little bit information about it. The next is a 24-hour nurse line. This number is available to Tailored Partners members, and it is a phone number where you can call and talk to a nurse, a registered nurse, and ask questions. It may be questions about symptoms, and they can help you at that time and kind of triage, what they call triage that situation. That's available 24 hours. The next number on there is the 24-hour behavioral health crisis line. This line is also available 24 hours. This is when there is a mental health crisis going on with you, or with somebody that's with you. This number is available to anyone and is open 24 hours a day. They're going to talk to you about the mental health crisis and help discern what level of crisis it is, and provide direct information for you, or maybe connect you to multiple crisis team that can actually come out and see you if that is needed. So that is our behavioral health crisis line. All right, and then right at the bottom of your Medicaid card, on the back, you see a provider services number. So your provider is your doctor or your therapist. It's the person that's providing that service for you. And right up above that is what's called a prescriber service number. And a prescriber is one who prescribes medication, or perhaps they prescribe medical equipment. But that phone number is for your prescriber, who would be your doctor or your medical professional. So your ID card has a lot of great information on it. So I want to make sure you keep it with you and know that you can access that Medicaid card for information. All right, and here's just maybe a better view of all of those phone numbers that I just mentioned. There you can see member and recipient services and the phone numbers in the second column there. Behavioral crisis, non-emergency medical transportation, that nurse advice line I just mentioned, pharmacy services, that's that pharmacy number on the front of your Medicaid ID card. It's open 24 hours a day, 7 days a week. The nurse line, 24 hours a day, 7 days a week. And of course, the behavioral health crisis line is open 24 hours as well. And at the bottom, provider services, that's for your doctor, your therapist, the agency that's providing your services. So again, you'll get these slides after the session via email. So just a great reference tool to utilize for these phone numbers. Right, so now it is time to get to our main topic for today: tailored care management. So you go ahead and go to the next slide, Beth. So tailored care management, it actually began as what we call a soft launch in December of 2022. So many of you may already have a tailored care manager. So what is a tailored care manager? Tailored care management is having one care manager that is really going to work together with you and your medical support. I know some of us have more than one doctor, therapist, or counselor. I know I do. And I know my son does too. And so sometimes, a lot of times, it's helpful for those individuals that you support your health needs to be connected together. And so that's what tailored care management is about. It's about pulling everyone together, whether they be the providers that provide service because you have a severe and persistent mental illness, or perhaps you have an intellectual disability and you receive support services. But then you also have a doctor that covers your medical and physical needs, and those are connected. So that's what tailored care management is about. It's about pulling everyone together into a team, and that's what your tailored care manager can do for you. All right. So some people, ask that question, why tailored care management? Why do we need it? So I just started talking a little bit about that, about why we need it, how it pulls all of your healthcare providers together. So what we know is that people who have severe mental illness or individuals with intellectual and developmental disabilities often die 20 to 30 years earlier than the general population. That's a big number, 20 to 30 years earlier. And we also know that these early deaths are sometimes related to a higher incidence of chronic illness. Sometimes they're not diagnosed due to the mental health illness or the intellectual disabilities. Maybe it's due to lifestyle or just lack of preventative care. It's also connected to what we call social drivers of health. And what that means is it's about, having a roof over your head, people who are homeless, or perhaps a lack of support or lack of finances. It's about trauma and anxiety around health issues. And all of these things often prevent individuals from accessing appropriate care in our system. And the other thing we also know is there's bias and stigma created to I am fumbling here. There's bias and stigma that's connected to individuals with severe mental illness, those with intellectual and developmental disabilities. I think we're all more aware of bias and stigma these days, but it is connected to the quality of care provided. And so it's important to have tailored care management, pull everyone together, and talk about the needs of the individual together. That tailored care manager can act as an advocate and help you learn how to be a good advocate. And so evidence does show us when we pull these things together, it improves outcomes. It also saves money and increases prevention interventions. More people take part in prevention, and it leads to less emergency department visits and hospitalization. So why tailored care management? There are a lot of reasons why tailored care management. It's so important to pull everyone together. All right, so who is eligible for tailored care management? So all partners tailored plan members are eligible and have tailored care management available to them continuously throughout their enrollment in the tailored plan. And so that also includes individuals who are enrolled in 1915I services. Some of you may be engaged in those services that they're fairly new and came out to help individuals access more services, and those who have the innovations waiver and the TBI waiver. And then also, the thing that I wanted to point out is that some members in Medicaid Direct may be eligible for care management or tailored care management as well. So you're going to want to reach out to find out about tailored care management and Medicaid Direct. One more thing I want to point out about eligibility. There are some services that are offered by the tailored plans. The tailored plans focused on those individuals who need more enhanced services. And some of those services include care management. And so if your service includes care management, you would not get tailored care management at the same time. If you already had tailored care management, you popped into that service, you would get your care management through the service, and then tailored care management could be transitioned back. So let me just share with you the services that are included here. The first one is known as ACT. And again, that is an acronym. It stands for Assertive Community Transition Team, and it's focused on individuals with severe and persistent mental illness. The next one is ICF, IID. You may have heard of that. That ICF stands for Intermediate Care Facility. IID is individuals with intellectual disabilities. And an intermediate care facility is a residential setting. So if you're in and live in that residential setting, or perhaps a family member does, that is an ICF, IID, care management is provided with that service. So you wouldn't need tailored care management. There is also CMARC, which is children taking part in care management for at-risk children. And then the last one is what's called high fidelity wraparound. And this is also for children taking part in a higher level of service, and it includes care management as well. So I just wanted you to be aware that there are some exclusions, but it's only while you're participating in that particular service. One more thing when we're talking about eligibility, you can leave it there, Beth. The members who are enrolled in the Innovations Waiver and the TBI waivers, they have care management connected to their waivers, and their current care managers would be their tailored care manager and function as a tailored care manager. All right, so let's take a moment to talk about the role of the tailored care manager. So again, the care manager is that person who works together with you and pulls together a team, and that team would include those who support you with physical health, behavioral health, being mental health and substance use disorder, and then those social drivers of health that I mentioned. If you have concerns about housing, transportation, food, or personal safety. So all of those things is what the tailored care manager do. So what do they do? The first thing that they do is they complete a care management assessment. They do this at least once a year. And what it does is it is a pretty extensive assessment, and it focuses on what your needs are and helps the tailored care manager and those around you know what supports to put in place. And with that assessment and the team that's pulled together, the care manager takes the lead on developing a care plan, or sometimes it's called an individual support plan, depending what your needs are. Those of you who are familiar with IDD, intellectual and developmental disabilities, it's typically an individual support plan. So that plan is developed, and the team, along with the care manager and yourself and your family, you all are very involved in this process. And you are the ones who make a decision about whether that plan is going to meet your needs. This plan is a living and breathing document and can be changed, but it drives your health plans. They're going to maintain regular contact with you, and that regular contact depends on the person's needs and the requirements of care management. So you're going to work together with the care manager about how often that contact happens. They're going to coordinate services for you and coordinate with the professionals that work together with you, those healthcare providers that I had mentioned. And they're going to help you address unmet needs, which may be connected to those social drivers. They may connect you to local programs and services. And they're going to be available to you the entire time you are part of the tailored plan. And this would be true whether you're with Partners Health Management or you are part of one of the other tailored plans. So that, in a nutshell, is what the tailored care management does. So this shows you just a picture of how the person, the individual being supported, is really, really placed in the center. And then if you take a look at what's around the person in the center, That's really your care team. So it's in that green the green donut in the center. And you can see if you look at each one of those things in the center, or in that green donut, it mentions clinicians, service providers, pharmacists, could be family members, social workers. It's going to look different depending on the individual. And then if you go to the outer ring, you'll see that it shows community connections. So it could be a school counselor, it could be housing services, veteran supports, social services I already mentioned, social supports. Again, it's going to be different for every individual. Those are community connections that go along with pulling the care team together. Right. Member choice. Tailored care management is your choice. You have the option, you have a couple different choices. One is that you have the option to select who provides your tailored care management. So your tailored plan can provide the tailored care management. I'm going to just mention them and I'll come back and give it a little bit more definition. So the tailored plan, which in our case would be partners, it could be that you live in another catchment area. So it might be via Alliance Health or Trillium. There are also care management agencies, and those are provider agencies in the community. It could be an advanced medical home, an advanced medical home plus. All right. So care management agencies, let's go back to that. They are providers in the community that have been certified by the state of North Carolina Department of Health and Human Services to provide tailored care management. And your tailored plan would be able to provide a list of care management agencies to you. An advanced medical home plus it's a doctor's office. It's a doctor's office that also offers care management, could be tailored care management. So it's important to know that you have a choice. The advanced medical care home may be for someone who has more complex medical needs in addition to behavioral health needs. Care management agency could be someone you choose because you prefer to go with someone outside of the tailored plan. And you can also stay with the tailored plan who historically has offered care management. Let me glance at my notes here very quickly to make sure that I'm giving you all the information that you need. Each tailored plan, it provides education and support to the care management agencies and to the Advanced Medical Home Plus. So the tailored plans are charged with making sure that the care management agencies and the Advanced Medical Home Plus has all the information they need. Maybe it's the information they need to access services. But we have here at Partners, we have a team of clinical support specialists, and each care management agency has a clinical support specialist assigned to them. They can reach out to them to get questions answered as they're working together with you. It's also important when you're choosing a care management agency for your tailored care management is to know that you're looking at the ones that focus on your specialty area, because some care management agencies focus on IDD, intellectual disabilities. Other care management agencies focus on mental health, mental illness, and substance use disorders. So it's important to have that information as well. And as I said, partners can provide you with that information, or if you're in another catchment area for another tailored plan, they can provide you with that information. So member choice, it's important to have all the information to make a choice. You can also opt out of care management, tailored care management, if you choose. It is your choice. So right there at the bottom, in the bottom block, it says you can opt out of tailored care management. If you wanted to do that, you would simply contact partners and let them know that you are not interested in tailored care management, and you would call that phone number that I said. If you're that person that needs that one phone number, and it's right there at the top in the top block as well. So that top block is about changing your tailored care management agency. So perhaps you chose one or you were assigned to one, and it's not what you need. You can change twice a year without cause and at any time with cause by contacting partners at 888-235-4673. You can also go through your member portal, Member Connect. I mentioned that earlier. If you have a login, you can go in and access a form that you want to change your tailored care management agency. So I said you can change it twice a year without cause. So that means you don't have to have any specific reason. You can just let us know that you want to change. If it has a true cause, and what is cause? So cause may be that you don't feel respected by the agency that's providing your care management. They're not providing what you need. That's cause. So at any time, you can change your tailored care manager because of that. And again, if individuals are enrolled in the innovations waiver or the traumatic brain injury waiver, the TBI waiver, then their care management for that waiver acts as the tailored care manager. All right, this is another important thing to know. Conflict-free care management. So this is a federal requirement for individuals receiving waiver services, such as the innovations waiver. I just mentioned that. And it means that individuals should have the opportunity to receive their tailored care management from a different agency than the one providing your innovations waiver services or your 1915I services. So it ensures that the member is receiving the care management that is not biased to that agency. So conflict-free care management. It applies to members enrolled in the innovations waiver, members enrolled in the TBI waiver, and members receiving 1915I services. All right, so in summary, tailored plan members are eligible for tailored care management. I also mentioned that Medicaid direct members may be eligible for tailored care management. Members choose or are assigned the agency to provide tailored care management. You can change agencies for tailored care management. We just talked about that. You can also opt out of tailored care management. So what do? The tailored care managers, they assess your needs. They develop a plan for your whole person. And they're part of the team to provide your support and help connect all of those individuals together so they can work together with you. So this is the contact information for tailored care management. If you have questions, that top number is for IDD, 833-618-7974. And the bottom one is for mental health and substance use, 833-842-6311. All right, so how are we doing on time? We have about 20 minutes. So right now, what I want to do is pause to see if there's any questions in the Q&A, and Beth, our Zoom guru, is going to moderate those questions for us.
Okay, I'm going to give our panelists just a moment to get prepared to be back on camera. Okay. All right, we have one question. It says, if the care manager coordinates all these services, why does there have to be a separate plan for services like LTCS that the provider develops and manages, and the TCM does a separate plan for 1915I services? Anyone want to take a stab at that?
I can take a stab at that if you'd like. So I'm Beth Monaco. I am the Director of Care Connections here at Partners. And actually, I do think that if the team would rather have one plan for the person, that is an option. And so my suggestion would be for the team to get together and talk about that. Certainly, all the providers involved in the care manager would want to make sure the needed components and elements are included in that one plan. But I would suggest bringing that back to your individual team as an option.
Thank you, Beth. The next question is, does Partners handle all Medicaid plans? Are you like a one-stop shop in addition to the insurance companies that they are linked with?
Hi, this is Allison Crotty, Senior Director of Member Services. Does Partners handle all Medicaid plans? We handle 2 Medicaid plans, Tailored Plan for some of our members and NC Medicaid Direct for others. So the Tailored Plan has added integrated physical health now since July 1st. And then Medicaid Direct is the way that members have been receiving their Medicaid when they get their behavioral health and other services from Partners and their medical providers or any Medicaid provider in the community. So we are a one-stop shop more for the Tailored Plan. And the Tailored Plan even has some services that are carved out like they are in Medicaid Direct, such as dental. Let me know if there are other questions, follow up with that. Thanks.
Thank you, Allison. Who is considered the clinical home with tailored plans going live?
I can answer that. This is Wyatt Bell from TCM Oversight and Support. It depends on the service. If it's one of the services that was on the slide that Ann covered, like ACT or CMARC, that will be the clinical home. If you're getting innovations or tailored care management through a CMA or through Partners, then the CMA or Partners would be the clinical home.
Thank you, Wyatt. If an individual is interested in signing up for tailored plans, do they go through Partners or local Medicaid?
I can answer that. So you don't actually sign up for the Tailored Plan. North Carolina Medicaid makes the decisions of enrollment into which plan. So they look at previous use of services. They look at diagnoses. They also look at even what medications you're on. And then they make a decision which plan. If you want to change your plan, you do have to call the North Carolina Medicaid enrollment broker and discuss your options with them. They do what's called choice counseling, and they can help you make a decision. They may not always approve your wish to go to a certain plan. It just depends on many factors. But we can put the enrollment broker information in the chat.
We did have some questions that were previously submitted, so I'm going to go ahead and go through those. What do you do if your primary care physician does not accept the tailored plan? Can you keep your doctor?
I can answer that one. So I'm Angela Griffin. I'm the Member Operations Manager, and my team handles the PCP assignments. So what we're doing is we are working with our health plan partner to ensure that members have access to their historical providers. For for those providers who are considered non-participating or out of network, they can still submit paper claims and be paid for serving our members. There is also a flexibility period until January 31st, 2025, where you can continue to see out-of-network providers as long as they are enrolled as Medicaid providers. We are monitoring the situation very closely to ensure that members can continue to see the provider if the provider wants to see them. And we're working to outreach the provider to see if they would like to be fully contracted in network for our tailored plan. And we're providing education and guidance to the providers. If the provider does not choose to fully contract and wants to enter into what we call a single case agreement to serve a particular member, we are working with them in that capacity as well to get those single case agreements. So hopefully that answers your question.
Thank you, Angela. The next question is, if you are an SPMI and receive Medicaid and Medicare, where do you fit for services? You're in persistent mental illness.
Could you repeat that again? If they have Medicare and Medicaid?
Where do you fit for services?
Okay, so if it's fitting for services, services would be provided by an in-network partners provider who serves both Medicare and Medicaid. As far as the health plan, that's determined by North Carolina Medicaid. And if you are dually insured with those two insurances, you would most likely be in North Carolina Medicaid Direct, unless you are on the Innovations waiver, and then you would be in the tailored plan.
Thank you, Allison. If the provider notices that the member's selected PCP is not assigned, what is the next step? Do members use the tailored plan insurance card or their Medicaid card at the doctor's office? Does the tailored plan cover outside physicians like dentist and eye?
Okay, so I will answer that question. So if there is a different PCP on the tailored plan Medicaid card, the member can still see any PCP that is contracted with Medicaid. They do not have to specifically see the one that is listed on their card. They would use their TP Medicaid ID card for everything except for dental. Dental is a carved out service, and I believe they continue to use their, I may need Allison to help me bail me out on that one about which card they use for dental. But the member does not have to, the member can see any contracted Medicaid provider. They do not have to see the one that is listed on their card.
That's correct.
Thank you, Angela. How do you verify if you are enrolled in a tailored plan?
So it depends on what your Medicaid ID card looks like and what packet you received in the mail. Plus the NC Medicaid enrollment broker mailed notices to advise you of what plan you're on. It'll say North Carolina Medicaid Direct or Tailored Plan. Your handbook will say Tailored Plan or Medicaid Direct. Your ID card for Tailored Plan, at least for partners, is a smaller white card that has partners logo on it. And it has, I think we showed it earlier, so it has all that information. The Medicaid Direct cards are the rectangular gray paper cards that have your LME MCO on it, as well as your Medicaid ID card and your PCP.
So if anybody else has any questions, you can raise your hand and I can open your mic and you can ask your question, or you can put it in the Q&A. And we'll give you just a minute, and then we've got a few more things that we're going to cover. Okay, we can move on to our slides. Stacia, are you ready?
Yes, I'm ready. Okay, hello everyone. I'm Stacia Bonner, part of the Member Engagement Department, and I'm going to discuss a couple of things in reference to Taylor Care Management and in reference to about partners in general. First thing I'm going to introduce and discuss is Partners Health Library. As you know, we all know that when we are making a good or effective or sound decision, we need to have all of the information, specifically when it comes to your health. So that's why we partner with HealthWise to create the Partners Health Library, where you can find resources to help you live a healthier, safe, and better life. The Partners Health Library is an online library with articles, tools, and resources about health. Experts in healthcare update is completed regularly, so you can trust the information is accurate, reliable. If you want to learn more about your health condition or you want to take a screening, visit the Partners Health Library, and I believe Lindsay did just drop the information in the chat. Okay, and I'm gonna, Anne did touched a little bit on Member Connect already, but I'll speak briefly about it. Member Connect is a partners member portal on Partners website. Is very important is for you to have access, on-the-go access to your information. It's on Partners websites. It's for members and guardians, and you can simply select Member Connect in the upper right-hand corner. And you want to make sure you create a login. You can go on to the next slide. There we go, transitions of care, perfect. Okay, with transition of care, with North Carolina Medicaid managed care, individuals moves can move between health plans for the following reasons. A change in Medicaid member service needs, change in county or residence, or a change in Medicaid status. The Partners Transition of Care team is here to support you through this process. The most expedited way to start the process is to have your healthcare provider complete the request move form. This brings our transition team in quickly. And Angela, who you heard earlier, she is the team lead, and she is very effective and adequate and efficient on this. Definitely a guru. Members or providers can also make a request to change health plans by going to NC Medicaid Enrollment Broker, this site, and I'm sure that Lindsay will be dropping that site in the chat as well. I'm going to go on to member engagement slide, speak briefly about member engagement. We are here, as Anne mentioned earlier, you probably have seen us out in the community, but we're here to support our members in our community, providing education, providing that advocacy, kind of being that support to individuals who have small, simple questions as well as to the larger ones. I want to make sure that we get you to the correct area or person to talk to ensure that you have support and that you are getting your needs met. In reference to PICS Help mobile app is our app that we utilize to monitor physical and mental health. We encourage our members to register for the PICS Health phone app. You can download this app to your mobile device, or you can go to www.hipyx.com, and you can get a great day rewards of $10 upon registering for the PICS app. staying in touch with us. You have heard this number, and it's actually my number that I use all else fails, even internally, 1-888-235-4673. You want to make sure that any question that you may have, that you give that number a call in reference to keeping your contact information updated. That's very important. You will receive documentation from partners, and we want to make sure we get it to the right person, the right address. So when anything changes, make sure you notify your local Medicaid Department of Social Services, as well as you give us a call to update that information. Stay connected. This is, if you wanted to stay in the know of what's going on, things are changing every single day. As we speak right now, I'm sure there's a change that has been implemented. But if you want to stay active and stay in the know, go ahead and hover over that QR code, and you will learn a lot about our training opportunities here at Partners, any upcoming events, whether you're a member or provider or someone with an interest in behavioral health. We want you to subscribe and to sign up so you can get emails and upcoming information from Partners. And I'm going to turn it back over to you, Ann.
All right. Thank you, Seisha.
You're welcome.
So we're just getting ready to wrap up here. So one thing I want to share with you is that your feedback is important to us. So if you would take a moment, as Seisha said, you can just grab that QR code right from the screen with your phone right now. This survey is going to take you just a few moments. There are just a few questions. And this is really helpful to us to let us know how we can improve and what information you are interested in. You also can see a link there at the bottom of your screen, which Lindsay will drop in the chat if she hasn't already. So please, your feedback is really important to us, and we appreciate that you share it with us. All right, so right now, if you have any more questions, now is the time. I see 157 on my computer, so we've got 3 minutes. So if you have any questions, feel free to drop it into the chat really quick. Beth, I don't know if you see any more questions.
I do. What is included in the Member Connect portal? It was mentioned about documents and access to email. What kind of documents? Approved plans?
All right, I can take that question. So the Member Connect portal has a lot of different information in it, and it is being updated on a regular basis. So what you can see in there is the documents I mentioned. You also can take a look at your benefits and services. What it shows your benefits, like when your Medicaid begins, when it ends, what your service is named as in the tailored plan. You also can access the Partners Health Library. You can access some assessments, evaluations, self-assessments, where you can go ahead and click on something. It's very confidential. Perhaps you're concerned, but you don't really know if you need some help from somebody else for depression or anxiety, that type of thing. So that's something that you can do. There are a lot of resources listed, anything from information about the care management assessment to the SIS assessment, which is connected to IDD. You can access those forms I mentioned before to change your PCP, to change your tailored care manager, to request a Medicaid ID card. Very soon, you will be able to see who your tailored care management agency is, your primary care provider. That will be noted in your portal. So it's somewhat similar to when you go to My Atrium or Novant Health, that kind of thing, where you can see your portal. It's not as detailed to where you're getting notes like from your actual visits, but it's information about your health plan here at Partners. You can access events, training. So yeah, a myriad of things. I hope that's helpful.
Thank you, Anne. There's one more question. There are persons so ill that they do not open the information envelope or grant permission for family members to help them navigate the tailored plans. Do you have accommodations to help these family members help their loved ones engage in services and supports?
So what I would say is if it's your family member or you know somebody that has a family member in that state, is that the family member can reach out to Partners Health Management. And I would reach out to that main phone number, that 1-888-235-4673, and they should share what's going on. They may connect them to care management. They may connect when you talk to someone in the Access Call Center, or you may get connected to member engagement. So our role here is in member engagement is not only to share information about services, but to help you navigate the system. And, you know, what is it that we can do to help this individual? So yes, you can call on us and we can help you get pointed in the right direction. Even if it's an agency outside of Partners, we can help you get there.
Yeah, and I would have a tailored care manager that whether it's from an external community agency or Partners, that they can be the first person to call.
Great question.
We do have someone with their hand up. Okay. You can unmute and speak now.
Do you have to help unmute her? Or
Shanna Smith. Okay. Well, it is 2:01. So you can call any of the numbers and we can help you with your question. And we are going to close it out for today.
You can also send an email to memberquestions@partnersbhm.org. So thank you so much for joining us today. Great information, great questions. We appreciate those questions. And thanks for joining us. Next month, we'll be talking about maternal mental health and mental wellness. So see you next month. Thanks. Bye.